Good day, everyone. Today, we will be talking about COVID-19, a video presentation. First, let's talk about the background of COVID. COVID-19 originates in a wet market named Huanan, seafood market in Wuhan, Hubei Province, China on December 2019. World Health Organization officially named the disease caused by the novel coronavirus as Coronavirus Disease 2019 or COVID-19 on February 12, 2020. Coronaviruses are a large family of zoonotic viruses, means these viruses are able to be transmitted from animals to humans. It can cause illness ranging from the common cold to severe respiratory diseases such as dry cough, fever, shortness of breath, breathing difficulties, and in more severe cases, infection can cause pneumonia, severe acute respiratory syndrome, kidney failure, and death. It can spread from one person to others via droplets produced from the respiratory system of infected people, often during coughing or sneezing. Middle East Respiratory Syndrome, or MERS, of 2012, and Severe Acute Respiratory Syndrome, or SARS, of 2002, show similarities to recent Severe Acute Respiratory Syndrome coronavirus 2. Other strand of COVID-19. Scientists around the world are tracking changes in the virus that cause COVID-19. Their research is helping experts understand whether certain COVID variants spread faster than the others. Human coronavirus types. Scientists have divided coronaviruses into 4 subgroupings called Alpha, Beta, Gamma, and Delta. 7 of these viruses can infect people. HCOV-229E, OC43, NL63, and HKU1 are considered as pathogens causing upper respiratory tract disease and responsible for up to 15% to 30% of common colds in adults. Unlike SARS-CoV that spreads from the upper airway to cause a severe lower respiratory tract infection, HCOV-229E replicate principally in the upper respiratory tract epithelial cells where they produce virus and cause local respiratory. MERS coronavirus, a beta virus causes Middle East Respiratory Syndrome, or what we call MERS. MERS is a zoonotic virus, meaning it is transmitted between animals and people. 27 countries have reported cases since 2012, leading to 852 known deaths. SARS coronavirus, a beta virus that causes severe acute respiratory syndrome, or what we know as SARS. SARS was first reported in Asia in February 2003. Illness spread to more than 24 countries in North America, South America, Europe, and Asia. Since 2004, there have not been any cases of SARS reported anywhere in the world. SARS-CoV-2, which causes COVID-19. SARS coronavirus 2 is a highly transmissible and pathogenic coronavirus that emerged in late 2019. It has caused a pandemic of acute respiratory disease named Coronavirus Disease 2019. It threatens human health and public safety. COVID-19 different type of variants. Over the past few months, new variants of the virus known as SARS-CoV-2 have started to emerge from the US to UK to South Africa and Brazil. Scientists have since learned that the virus has changed in the way that increased its ability to spread and cause more severe disease. These diseases are known as UK variant, South Africa variant, and Brazilian variant. How does COVID-19 affect the human body? Not all coronaviruses react the same in the human body. This particular virus can lead to COVID-19, which may or not produce symptoms in people. The most common symptoms people have are fever, cough, loss of smell or taste, muscle aches or chills, sore throat, and shortness of breath. If you have these symptoms, you should get tested for COVID-19. A person is infected with the new coronavirus when he or she comes into contact with droplets from the cough or sneezes of a person who already has the coronavirus. Within 2 to 14 days, a person who has been exposed to the virus will begin to develop symptoms. Once you have contracted the virus, it begins to move down your respiratory tract. The lower portion of your lungs has the types of receptors on cells that allows the virus to more easily invade and thus begins to grow. The receptors are called ACE2 receptors. COVID-19 affects different people in different ways. most infected people will develop mild to moderate illness and recover without hospitalization. How does COVID-19 affect the society? The COVID-19 pandemic has resulted in a significant loss of human lives around the world, and it poses an enormous threat to public health, food supplies, and workplace. The pandemic's economic and social consequences are devastating. Tens of millions of people are at risk of slipping into extreme poverty, while the number of people who are undernourished is estimated to be at about 690. Almost half of the world's 3.3 billion workers face job loss. The majority of informal economy workers lack social security and access to affordable healthcare, and they have lost access to economic assets. Some people are unable to support themselves due to lack of money during lockdowns. The pandemic has had an effect on the entire food chain, revealing its vulnerability. Farmers and agricultural workers have been unable to enter markets, including to buy supply and export their produce, due to border closure, trade bans, and confinement policies, disrupting domestic and foreign food supply chains and limiting access to safe diets that are both nutritious and diverse. The pandemic has wiped out workers and put millions of people livelihoods in jeopardy. The coronavirus disease has impact on every segment of our life, like commercial establishments, education, economy, religion, transport, tourism, employment, entertainment, food safety, sports, and etc. Coronavirus fears have led to panic buying of essentials across the world, including toilet papers, dried and instant noodles, bread, rice, vegetables, disinfectant, and rubbing alcohol. According to World Health Organization Director General Tedros Adhanom, demand for personal protection equipment has raised 100-fold, leading price to 20 times the regular price and delays in supply of medical items of 4 to 6 months. It has caused a shortage of personal protective equipment worldwide, with World Health Organization warning that this will endanger health workers. Tourism is one of the most affected sectors due to travel bans, closing public places, including travel attractions and monuments, and government advice against travel. Numerous airlines have cancelled flights due to lower demand, and the cruise lines industry was hard hit, and several train stations have been closed. How does people respond to pandemic? In the country of the Philippines, they implement national responses and regulations, such as price control of basic needs and commodities, granting interest-free loans, distribution of calamity funds, hazard allowance for public health workers. They announced a partial lockdown covering entirely of Metro Manila. They call it Enhanced Community Quarantine or ECQ, and put the other provinces to Modified Enhanced Community Quarantine MECQ and General Community Quarantine GCQ. Cash Aid, Social Amelioration Program, the Department of Social Welfare and Development DSW, implement an emergency cash subsidy meant for indigent families affected by the COVID-19 pandemic and relevant quarantine measures. These are the other examples of how does people respond to COVID-19. Mass testing, travel restriction, military and police. How the vaccine was being formulated by scientists, professionals, through clinical trial, until it will be approved for the consumption of the people. There is 7 ingredients for making this vaccine: antigen, preservatives, stabilizers, surfactants, residuals, adjuvant, and diluent. The scientists, they make sure that the ingredients they use is safe and effective to the human body. The key ingredient in a vaccine is the antigen. It's either a tiny part of disease-causing organism or a weakened, non-dangerous version, so your body can learn the specific way to fight it without getting sick. These are the 7 ingredients used for a vaccine. How are vaccines developed? These are the 3 phases for developing a vaccine. What are the different vaccines? Moderna vaccine was 94.1% effective at preventing laboratory-confirmed COVID-19 illness in people who received 2 doses of had no evidence of being previously infected. Johnson & Johnson. The efficacy did vary across geographic region, said Dr. Freihofer. In the United States, it was 74.4% effective, The efficacy did vary across geographic regions, said Dr. Freihofer. mRNA vaccines. It is an mRNA vaccine that codes for the virus spike protein and is encapsulated in a lipid nanoparticle. When injected, the cells crumb out the spike protein, triggering the body's immune system to recognize the virus. In phase 3 trials, it demonstrated 95% efficacy. Oxford AstraZeneca COVID-19 vaccine. Based on data provided by the manufacturer, the AstraZeneca Oxford vaccine, or AZD1222, has shown to be 63% effective in an ongoing, large-scale clinical trial. Pfizer-BioNTech vaccine effectiveness was at least 97% against symptomatic COVID-19 cases, hospitalization, severe and critical hospitalizations, and death. Furthermore, the analysis found a vaccine effectiveness of 94% against asymptomatic SARS-CoV-2 infections. Novavax COVID-19 vaccine. Vaccine efficacy of 89.3% in its phase 3 clinical trial conducted in United Kingdom. These are all informations that we gathered about the COVID-19.